In the future, mental health clinics may look much more like this. A virtual reality lab where you can enter the situations that trouble you and learn to overcome your problems. By putting on a headset, you can enter a computer-generated world that is authentic enough that it triggers your mind and your body to behave as if it's the real world. We've used VR for the first time to treat paranoia. Paranoia is unfounded fear that others are deliberately trying to harm you. People, for example, erroneously believe that others are trying to physically attack them, to mock them, or to upset them. It's common, particularly in patients given a diagnosis of schizophrenia. You can think of paranoia as an extreme form of mistrust, as a fear of other people. In this Medical Research Council funded study, we've used VR with 30 patients to help them relearn that they are safe around other people. And in this way, the paranoia begins to melt away. But it isn't simply a case of putting people in virtual reconstructions of the situations they fear. It has to be done in a particular way. Unsurprisingly, when a person is fearful of the others around them, they avoid being near them and look away. This reduces the chances of making any new learning. You're locked into your fears. So we encourage patients to do the opposite, to go up to the computer characters in order to fully find out whether they were safe, to let defences down and see what actually happens. The patients spent just 30 minutes in VR. They went on several underground train rides. Each time they went on the ride, more computer characters were introduced. By the end, they were experiencing quite a packed train ride, being very close to other people. We did the same for going up and down in a lift, gradually increasing the number of people that the patient was with in the confined space of a lift. So, step by step, the patients were helped to learn what would happen if they were around other people. The results were remarkable. From just 30 minutes in VR, using the right techniques, there were large reductions in paranoia. Immediately afterwards, over half the patients no longer had severe paranoia. Importantly, the benefits transferred to the real world. Later on, when the patients went into real social situations, they felt less distressed. It wasn't a definitive study, it was small and short term, but the results do show a great potential for VR.
In our state-of-the-art immersive virtual reality laboratory, we used an InViz SX111 head-mounted display and an InterSense IS900 hybrid head tracker. This allowed the participant to walk around a large room and experience a high-resolution surrounding image. Recently, we have begun porting our scenarios onto a low-cost mobile system, such as the Oculus Rift, that will allow us to deliver our therapy into clinics and wards.
Our ambition is to take this work forward, to use a longer and therefore more potent VR treatment, to use portable and affordable VR equipment, and to carry out a full clinical trial. If the exciting promise of VR is realised, then in the future, VR may have a central place in the treatment of mental health problems.